Hello, everyone, and welcome to the Wednesdays at 1 show here on my Facebook Live and on Media Prepared's Facebook Live. As you can see, today we're talking about COVID-19, and I have two very special guests. They have compelling COVID-19 stories. I'm not going to spend a lot of time really talking about the pandemic and all those things. We're going to get into that. But because we have so much to cover, I'm going to go right into it. I'm going to start by introducing my guests. I have here Jonathan Soto. And Jonathan is a personal injury attorney based in Boston. And he is going to share first his story of his experience with COVID-19. Jonathan, first of all, thank you. And tell us your story.
Oh, thank you, Eric. It was a pleasure to be here. Thank you for having me. I think it's a story basically just like everybody else that has perhaps contracted it. One day I'm feeling fine, and the next day I was pretty ill. Speaking to doctors after I tested positive, she said I checked off all the boxes, the aches, the chills, everything, loss of taste. The scary part, obviously feeling the sickness and feeling ill, but, not knowing who maybe you came in contact with that you might, who you might have given it to. And the waiting period to see if they're okay and to see if they're going to test negative. But it was a different experience, not only the physical symptoms, but then, psychologically you're like, all right, am I going to get better? Am I going to be one of the horror stories? Am I going to have long-lasting effects, long-lasting residual effects? And it's one of those things that, there's so little information that we don't know. So, it's time will tell thing.
Right. And now, because you've contracted the virus, you actually now have a pre-existing condition. Is that right?
I don't know if it falls under. I've heard that. I've heard that can be considered a pre-existing condition, and I've heard, not really. I don't know if doctors or politicians are saying it, but you do see a lot of people on Twitter saying that once you have it, you have a pre-existing condition. So, kind of see what insurance companies will say about that and how the legislature will dictate that as a pre-existing condition.
Well, I imagine it's going to become one of those sort of standard questions on a questionnaire, right? Do you smoke? What are some of the things that are going to impact your health going forward? I think that's going to become a pretty standard question because we're talking about 7.5 million infected. We know the number, everyone knows the numbers almost by heart, right? 7.5 million infected, 210 dead, 210,000 dead. So I think it is going to be something that is going to be with us in a way that probably all of our lives we're going to be looking back on this time and how things change. This is going to be a marker in time.
Yeah,
Go ahead.
No, I completely agree with you. I think that this is a moment where, they're going to probably be setting some precedents on, how this, particular condition, whether you've had the virus or whatnot, how it's going to proceed forward with insurance claims and things like that, and the access that you're going to have to healthcare based on, potentially having to disclose that you had this.
Thank you so much, Jonathan. And we're going to continue the conversation. My second guest here today is a woman that I met not so long ago. She's down in New York City. Her name is Dominique Remy. And she has an amazing story. And I say amazing because to look at her and talk to her and see her today, you'd never know what the last 8 months or so have been like. But I really don't want to tell her story for her. I just want to introduce you to Dominique Remy. She's a New York City-based writer, producer, documentary filmmaker, and we are so glad to have you here, Dominique. Tell us your story.
Thank you so much for having me. I really appreciate you giving me and Jonathan this space to talk about, the last couple of months. So my story, similar to Jonathan, I contracted the virus, but a couple of days prior, it was pretty devastating when my father, we didn't even know what was going on. He was someone who was chronically ill. He's had diabetes for about as long as I've been alive, since he was 28. I'm currently 29. And he also had hypertension and cholesterol. And I actually did move back home to sort of work on projects that I wanted to work on and be more independent, but also to be his caretaker in the times when I wasn't working, so I could just be closer to him, because he was having complications. And a lot of the people that we hear who have passed on are people who have these sorts of complications, like comorbidities, like diabetes and hypertension specifically. So this happened around, and I don't know if you remember that New York Times story that came out where it said the first week of April was the deadliest week in New York for COVID-19, and that actually happened in that week. My mother and I both were exhibiting symptoms of COVID-19, and then we went and got checked out. I want to say April 6th and 7th. My father, when I started noticing he was having some symptoms that didn't align with, hypertension or like anything with diabetes complications, I started noticing that in March, and he unfortunately passed away April 10th. So in that span was a lot going on. With my father, he was exhibiting a lot of flu-like symptoms. And at the time, everyone can tell you it was just the 3 symptoms. Everyone was like, check these 3 off. And then if you don't have these 3 symptoms, then you can comfortably say it's not COVID. He didn't have any of those. He wasn't short of breath until the very last moment when we did call the ambulance. He didn't have a dry cough. He did have a cough, but it wasn't dry. And up until the time he went to the hospital, he didn't have a fever. He actually went to a doctor's appointment. He had a wound care appointment in the hospital. There's like a separate clinic in the hospital for just regular appointments. And he has that standing appointment every Friday. And because they were taking precautions because of COVID, they do the thermometer check prior to coming into the hospital. And he was fine. And that was March 30th when I started noticing some symptoms, and he was fine. He didn't have a high temperature. He was seen by the doctors. There was nothing that tipped them off to then transfer him to the emergency room. But the thing that stood out to me the most in his care, or his inability to receive care quickly, was those 3 aspects where, I would call, because there was a lot of telehealth aspects to it. I would just call doctors, and, I would be on calls with nurses and going over the timeline and going over the symptoms. And I called the hospital 4 times, and they said, it does not seem like it is rising to the level of an emergency, which is why there was such a delay in his care, because they were prioritizing breathlessness specifically. Even when I called 911, when he did start breathing more shallowly on, I think, April 4th, the operator told me, is he out of breath? And I said, yes, he's breathing really shallowly and his breathing is really abnormal. And when the EMT people came in, that was the first thing they wanted to check, was his breathing. And even a neighbor of ours who I think also had a pre-existing condition with asthma, he called because he felt uneasy breathing, and his breathing didn't rise to the level of an emergency. So this is what kind of happened throughout this whole ordeal, is that my mother and I were full-time caretaking my father, going through these really puzzling symptoms and then trying to see what avenues to take, because we were told several times to manage these at home, because he had more flu-like symptoms rather than the symptoms at that time were considered COVID symptoms.
So, I mean, this sounds like just I mean, because this is at the beginning of the pandemic where people don't really know a lot of what we know now. I feel like all of us in our own way are a bit of an expert. We have the information. The information is available, right? So at that time, we really didn't know a lot. We didn't know what was what. And I know that hospitals were even saying, look, you have to literally be dragging yourself up to the hospital door for us to even take you or test you or anything. So knowing what you know now, what do you think? What do you think you would have maybe done differently then?
Oh, I think I would have, honestly, I would have gone at the first sign of something not going well, because he was so vulnerable to this. Even if we got a lot of pushback, I think we listened, because it was really overwhelming for the hospitals, and we would hear sirens all the time. And I'm happy for the care that my dad eventually did receive, because when we did go to the funeral home, the first thing they asked was, did he pass away in hospital or did he pass away at home? Because there was a huge spike of people passing away at home. Grateful for that aspect, that he was able to transition pretty peacefully, and he was under sedatives, and there were nurses, and he had like multiple doctors, cardiac, lung specialists who were attending to his care, and they kept me posted. But I just wish that there was more of a pushback, or there was more confidence on our part, now knowing what we know is like, no, these symptoms absolutely fall within COVID-19 as well. So he needs to see, he needs care. It's not just if he's exhibiting these 3 symptoms. And kind of like what Jonathan said with the symptoms, you didn't hear about the chills and the body aches like 2 weeks after. And I remember, because I was tracking like CDC and like reports from CNN, especially because they will constantly update the symptoms. And it was until 2 weeks after, when I was like fully in it, when I was like, yes, this is what we kept telling people on the phone. Like, these are his symptoms, and these are the symptoms that I have. I had extreme body aches, extreme fatigue. I was sleeping close to 20 hours a day.
Wow.
I also developed secondary infections, because just my immune system was fighting a lot. And I had a brief cough, and that was like the first thing to go away. But yeah, these symptoms weren't something that we knew to be part of the overall virus until weeks after we personally experienced it. So knowing what we know now, I would have really pushed for more care. We did what we could because we were told to manage it at home, and we did have a lot of doctors and nurses as resources. But I do wish we pushed saying like, no, these are actual symptoms that need to be seen.
That's an incredible story. I actually have one more guest that I'm going to add on. I want to introduce you. Sean Stellato, are you here with us? Sean, can you hear me? Can you hear me, Sean? Do you hear me?
My volume's off.
We can hear you. You can't hear us though? Okay, he's gone. All right. Well, we were going to have Sean come in, and Sean has his story, and hopefully we'll get him back at some point. But what I want to do right here is I want to just take this moment to make sure that I let people know, anyone who's watching, if you have any comments, any questions, any insights on today's topic, I want you to leave them in the section. We can bring them into the show. I'd love to hear from people that are watching if you have anything that you want to add to this conversation. But I'm going to bring it back to you guys. And I'm going to start with you, Jonathan. Tell me, what comes to mind when you see mask wearing being politicized?
Well, I mean, there's two sides of the story. There's one that people are arguing their individual freedom to not wear a mask and to take their own risks if they want to and risk getting the virus. And then there's, the argument that the masks work and, you should be wearing them. I was one of those people that was kind of against the mask at first. I didn't want to wear one, and I was also one of those, I didn't think it was that serious. But then as things started to develop and more, and then you have medical professionals that are saying, the mask can help. Might not be a foolproof plan, but it can help, after contracting it and potentially being able to contract it again and not wanting to and wanting to stay healthy. For me, it's a small price to pay. I don't think politicizing it is the right way to go about it. I think that, I don't think it belongs in any sort of political talk. It's, more scientific, and if it helps, people should wear it. Listen to the scientists, the ones that have the education, not the politicians.
Well, I mean, it's interesting because, you are, you're an attorney. So by nature or by profession, you're kind of like maybe skeptical, maybe a contrarian, maybe someone who's always going to sort of look at every single detail before maybe deciding one way or another. Do you think that had anything to do with the idea? Because you said that you were just like, I don't know about masks, or if I had a choice, I probably wouldn't wear one. What do you think about you caused you to kind of have that attitude at the beginning?
I think it was just not having the information about how contagious this was, how easy it was to get it. In my own personal situation, I have no idea where I could have contracted this. And it could have been at a gas station pump, or it could have been at a grocery store. But I was wearing my mask in public. I was wearing my mask, indoors when I went in to do grocery shopping or get whatever. So, I think that's kind of affected my decision more and more to wear the mask, is that, even though I did get it, is there a potential that this could help me not get it? Yes, there is. So why not just take that precaution? I don't really think that it's such a infringement on my individual liberty to have to wear something that could potentially protect myself and somebody else. That's a higher risk.
Mm-hmm. Yeah. Dominique, same question to you. What do you think when you see people politicizing the wearing of the mask?
It's frustrating. It's frustrating, but if you look at the broader context of politics in this country, a lot of things are rife for being part of the culture war, and being part, like wedge issues, and you know, things like climate change, which is still happening and a greater existential threat. That's been a that's been politicized and part of the culture war for close to 20 years. So like that, when you look at it from that lens, you're like, it's not surprising. Still, it's frustrating because there is a sense of urgency and people die because of this. And it's really strange that even after we know what's going on, and you know the numbers keep ticking up, that there's a very vocal group of people who still stand in not wearing them, and that's a little strange to look at. It doesn't make sense to me logically. I know that we took all the precautions. I was actually actively shooting on site when I decided to shelter in place in February, late February, because I knew
you an early adopter then.
I was an early adopter. I knew my father was very vulnerable, and there were some cases upstate, where not too far from where my parents were, that were starting to trickle down into where you know, it could be a really bad scenario. And I also do remember reading that the coronavirus is part of the SARS family. And I remember when I think it was bird flu, as well as I think it's a Middle Eastern respiratory syndrome. Those were considered, I don't think they were considered pandemics, but you know, where they were localized, they were considered epidemics. And I remember seeing a lot of people wear masks, especially up in Canada. So I was like, well, if it's part of the SARS family and people were wearing masks then I don't see a reason to not wear a mask now. But with its politicization, I get it in a like broader historical context. I just don't understand how, when you know the evidence is so very clear that it could mitigate the spread, why not just do it? I don't get it.
No, I totally get it, and I think that it's great. It's very interesting that you are an early adopter, like, because now we know that there has been probably cases of COVID that were going back maybe as early as November or December. Certainly there were cases in January and February where people got really sick, but they didn't know it.
Yeah.
And they were really, you know, sort of saying, you know, aha, that's what that was. So there were probably some undiagnosed cases, people not knowing what it was. And so it's interesting because I think you guys kind of come at it from two different sides of it, right? Where, you know, Jonathan, you were probably not as enthusiastic about saying, wow, we're in a serious situation here. Let me take every precaution. And Dominique, you were like, in February, I started to lock myself down a little bit, right? Mm-hmm. Which I think is interesting because I think it represents sort of the wide breadth, right? I would say that if I were to characterize myself, I was somewhere in the middle, right? I thought that, you know, there's something going on, but I don't know what it is. I don't know how serious it is. I don't know what's going to happen. But I'm going to start to take some steps. I'm not going to just totally take it out of hand. Mm-hmm. So now I'm going to try a second time to bring my good friend Sean Stellato in. Sean, can you hear me now?
Yes, I can.
Okay, and we can hear you pretty well. I want to introduce you to Jonathan and to Dominique.
Hey, how you guys doing?
Good
Hello.
afternoon, Sean.
Thanks for being here, Sean. I know that you just came out of one meeting and you were kind of in transit, and we saw you for a minute. But I really want to just let people know that this is another sort of level of this story, right? Sean, you have a super compelling story, and I want you to kind of let people know who you are, what you are, and tell us your COVID story.
Yeah, most definitely. Dominique, first of all, I'm sorry for your loss, and thank you for your narrative and educating people on what you went through, because it was, I know that's not easy sometimes to share, and, I'm sure your dad's smiling down. He sounds like he was an amazing man. My journey is just a humble upbringings, proud operator, a full-time sports agent, represent 12 players in the National Football League. And I have a couple books out that I'm extremely passionate about, No Backing Down, which the writer of Rudy and Hoosiers finalizes the movie script in the next 2 months. And I've got a kids series that my daughter came down with juvenile arthritis and lupus. We co-wrote a children's book together called Football Magic, Buddy's New Beginning. And we're going to have the sequel going to drop in 21. So that being said, most important title, proud dad of four beautiful daughters. So kind of got a little three-legged stool here, but COVID, unfortunately, I was, got the virus back on March 13th, and still have symptoms today. Haven't had sense of taste or smell since March 13th. And very, very trying time going through that ordeal. 17 days, night sweats to severe body aches. One night woke up, trouble breathing. And I'm fortunate that I have a backbone like I did in my wife, who was unbelievable in bringing me back to health. But it's something I urge everybody, people that think they're indestructible. Eric, when we first spoke, you mentioned, you're a pretty, super shape. Lifestyle of training and eating properly and just getting my rest. There's a balance there. So a lot of people were surprised when I got it, but just in terms of how I, work out and how I eat and the lifestyle I live. And it was very challenging. I'm fortunate, reading and listening to Dominique, and, my heart goes out to so many people that were affected and passed away from this. I'm fortunate that, I was able to get through this with just, a little hiccups, and, I'm enjoying more kale, eating it like it's, potato chips. I can't taste it. So it tastes, like I should say it tastes like anything. So maybe I'm hopefully, knock on wood, a little healthier than I would normally be maybe at this time of year.
Well, Sean, I mean, yeah, you're right. When you told me, I was shocked, because you represent football players, but you work out and look like you could play today. You're in phenomenal shape. I know that you really take great care in staying healthy and living an active lifestyle. But I also know that you are a player agent, and so you're on planes. You're crisscrossing the country. You're keeping unusual hours, day and night. So, even though, you probably, it's easy for me to say, well, you probably didn't get it as bad as you could. Imagine if you had sort of my lifestyle, my eating habits, you would be devastated, because you got a very severe case, and it was kind of a tough go for you there for a little while. And I know that family unit that you have, that is really your power source, you had to lean on them very heavily during this.
Yeah, I did. And I was fortunate enough to really have a good power source. And it was therapeutic when I talked to the Boston Globe, took some pictures. I wasn't going to do any of that. And then I thought about it. I'm like, maybe there's another person similar to myself that thinks they're indestructible and, can help to wear a mask. The crazy thing about it, Eric, is, my parents every single year get on me about a flu shot, which I do not get. And January, February, I was on the road probably 55 out of 60 days. And, I was down in Miami when I actually was exposed to the virus. And it's funny, I get through Indianapolis, which, that's where is the, kind of the mecca for free agency, the NFL Combine, networking with brands. I had probably 50, 60 meetings in 4 or 5 days and shook a lot of hands, gave a lot of hugs. I was fine out of that. And then I went down to Miami. I spoke at an elementary school, distributed some books with my friend from Legacy Healing, Mark Efron. And then I ended up, I was a keynote down at the East Hotel in Miami. And yeah, I ended up, my wife begged me to drive home. I'll never forget that Friday. She said, do not fly. I'm like, baby, it's 36 hours. I'm like, I'm crazy and I'll do things spontaneous like that. But it was her birthday week. So this was before anything. And I thought we were going to be able to celebrate. I wanted to be home. I didn't want to be mush for the kids. And little do I know that Friday, I felt like I played Eric in 2 football games. I was prepping up for a couple of virtual arbitrations and making photocopies. I had trouble standing. But yeah, it's an eye opener, and my heart goes out to, like I said, everybody that's been affected by this. But I guess the best way is, as we know, is you got to be proactive and wear a mask. I flew back on March 8th. I had sunglasses on, a mask, and a hood on, and I was the only one on the entire plane, like put in there like sardines without with the mask on. I was the one person on the whole flight, which was crazy. So,
Yeah.
But yeah.
Well, let me ask you. Let me bring it back to everybody. Just quickly, just go around. Sean, you said when was your contract date that you know?
Contact I was between March 5th and probably 7th.
And Dominique?
April 6th and 7th.
And Jonathan?
It was sometime between the 25th and the 30th of August.
Okay. So and so later in the game, and you guys, Sean, it sounds like you suspect that the elementary school may have been where you contracted.
I would say either there or I was a keynote speaker with about 250 guests. And I did a book signing immediately following it. And there was a lot of handshaking. I was trying to use this was at the very early stages. So I was trying to do the sanitizer. I was trying to do elbow bumps or foot kicks. And but we did a dine around at a really 5-star Chinese delicacy. Everyone was using the same utensils, real close. Mm-hmm. I don't know. So, as you guys know, someone could have just coughed and I could have walked into it.
Yeah.
And now.
And Jonathan, go ahead. I'm sorry.
Sorry, you go ahead.
Jonathan, you said you don't have any idea when you got where you got it.
So, based on the contact that I had with people within the prior 5 days prior to experiencing symptoms, with the exception of my fiance, I think that everybody else tested negative. So, like, I had drinks with a buddy who had tested negative. I played a round of golf with 3 other guys. They all tested negative. So, it could have been anywhere. So it's kind of really hard to pinpoint exactly what happened. It could have been, like I said, at a gas pump or a grocery store, and I think it especially being so late in the game, this was the end of August. So we already have all the information. We're taking the precautions, washing our hands, using sanitizer, things like that. So I was surprised that I had that I contracted it because I was taking all the proper precautions. If anything, I should have gotten it probably about in March and April when I was a little more skeptical and I had that mentality that this is just the flu. It's not really that big of a deal. Blah blah blah. But kind of like Sean's story where he was down in Florida and he was interacting with all these people. And then driving up, and then you said your wife told you to drive back instead of.
Yeah, she wanted me to drive back, but it's funny you say that, Jonathan. What you saying, you were around doing a bunch of different things. I know I didn't even realize that. A book signing at Barnes and Nobles too, down in Miami. There was a big festival down there. I mean, so I'm thinking back, I mean, where I could have, but as you said, it's like it's hard to pinpoint exactly, but I was definitely around those people, and there was no masks. I don't think masks were mandated then.
So back in
Which
March, we we had a golf trip planned, and we were debating on whether we were going to go, but we had planned it for so long, so we fly down to Florida, and we're in Logan Airport, and there's maybe like 25% of the people on the plane are wearing masks. They have their kids have masks on and stuff like that. But this wasn't really at the time where the masks were trending. It was just kind of like people were taking that precaution.
yeah.
Which in retrospect, maybe we all should have just been doing it from the get-go. So we fly down, we get down to Florida, we play some rounds of golf. We're at grocery stores, and it's Florida. Nobody's wearing a mask. It's just the way it was. And within the 4 days or 3 to 4 days that we were down there, that's when you really saw it ramping up on the news. Like, this is a thing. This is going to be bad.
Yes.
So we ended up not taking the flight back, renting a van, and then the four of us just drove from Florida back to the Northeast, like 27-hour drive.
You know, and I would have probably done that, Jonathan, if I wasn't Dolo. I was solo, but that's a smart move. Because looking back at it, and I don't even think anyone at the conference got the virus. It wasn't reported, which was crazy too. So, yeah, that's a smart move on your part.
So, Dominique, you have probably had to do a bit of maybe contact tracing, right? Because it was you and your mom and your dad.
Yeah, we haven't done like actual contact tracing, but we do suspect my mom is healthcare essential worker. And she worked at a nursing home. And if anyone's followed the news about nursing homes, they were the hardest hit, especially in New York and New Jersey. Where she was at, I think there was like 200 or so patients, now down to 70. There was another one in New Jersey where they like lost close to 200 people. So we suspect that there might be a connection there, because there was kind of like how everybody was just like on a back of their heels when this is happening, and like no one really understood what was going on or like the right precautions. I think that also happened in nursing homes, which have different different standards than like emergency rooms. And it wasn't until afterwards, like her entire unit caught it, and obviously my father passed. And then there was an ABC News report about the different nursing homes in New Jersey that lost a ton of people. Then there was like proper precautions, like gowns and PPE and gloves, and actually quarantining sick people in a different wing. So that's where we suspect that could have been, because I remember telling people, I was like, I only went out 4 times from like February to March. And that was only to go to the grocery store. And my dad canceled a couple of doctor's appointments because he was starting to get anxious. So he didn't leave. But my mom was going to work still. So. Yeah.
And you were an early adopter. You were sheltering in place in February.
Yeah. February 25th. I remember it because I just went virtual after that.
Wow. Well, let me ask you guys. And any of you guys can answer. But what should people know about COVID-19 that's not widely known or talked about from your perspective, as people who've been, permanently and very poignantly impacted by COVID? What would you want people to know?
I mean, I don't know if it's something that's not widely known, but it's something I think that's very important, is that, it doesn't discriminate, and it affects every single person differently. So, I mean, we have, the three of us have very different stories on how it affected our own bodies. And from the people that I've talked to, that I have known subsequent to me getting it, it's affected them differently than it's affected me. I think that I was fortunate that, the major symptoms of the chills, the body ache, the loss of taste and smell, the headaches, surprisingly, I never had a fever, which is kind of like one of the
Wow.
big symptoms, but I
Yeah.
never had a fever. Only lost my sense of smell and taste for 4 days. And really the residual effects were just the breathing. I had some issues with breathing, but I was, I'm happy that I was able to do some cardio yesterday for the first time without any issues. So, but then, Sean saying that he's, had months and months with no taste, no smell, and his symptoms have lasted months, and it affects everybody differently. That's why I get a little frustrated when you see things on TV where people are saying, "Oh, well, it's not that bad. It's not that big of a deal. You can beat it." Yeah, you can beat it, but you may or may not have those residual effects and those residual symptoms. I might not be out of the clear. I feel fine now, but who knows what's going to happen a few months down the road. And that's something that's kind of in the back of my mind all the time, because we don't know enough about this to really speak intelligently about the long-lasting effects.
No, and to elaborate on Jonathan, what you said, yeah, it's a great point. And, especially if folks have an underlying condition, that's where you really put yourself out in a really scary place. You saw it with the Broadway actor, Nick Cordero, I believe his last name was, that passed on. And especially the elderly, but you're right. Even, being, in my early 40s, I didn't think this would beat me. Like when I heard about it, I'm not gonna lie, I was like, well, whatever. I mean, I got through the flu. I was a little ignorant to it. My wife was so ahead of the 8 ball in terms of just all over me all the time. But with like Eric said, my job, being on airplanes and being all over the country. I mean, that's part of what comes with the job title. And the whole sense of taste or smell is. Yeah, it is. It's crazy. When you think about it, 7 months, you can't, taste anything or smell anything. You start wondering in your head, like, what is going on? But then again, like you said, Jonathan, it affects everybody differently. And, you hear about the heart, you hear about, some other areas. And same with you. I like to think I'm out of the clear outside of taste and smell, but you can't put your guard down now, in terms of just continue. I'm seeing a holistic doctor that I've been seeing for the last 90 days, trying to trigger the neurons in my upper respiratory, my nose, trying to get that something to jumpstart that. But in terms of wearing a mask, I would definitely people that don't wear masks, that are ignorant to it. You're playing with fire, because it could happen to you. Just never know when someone is, because one person, I believe, can affect 14,000 people. So you never know who's going to sneeze or cough or touch a doorknob or any of that crazy stuff. And I've been pretty like germophobic, maybe because I have little kids, like with touching doorknobs or wiping. Like I remember when I was flying down there, wiping the seats in the airplane with wet wipes. People looking at me like, what's wrong with you? And I'm just, luckily my wife has really got into my head with that. But even today, I'm like overly cautious now. I really don't even try to go anywhere, but if I do it, I'll take the mask off. But I hope that at least educated some people that are listening, in terms of, my personal battle with this.
Well, let me ask you guys, because this is something that I kind of am conflicted by, right? It's like, it's a little more accepted now, but what do you do when you see someone who doesn't have a mask on, or even if you're like, oh, they have the mask on, but it's on their chin, or it's just over their nose, over their mouth, or, something like that. I mean, I'm kind of like, I'm not a confrontational person, but I do give them a mean look. They can't tell because they can only see my eyes because I have my mask on. But like, how do you react when you see that, even after all this time, people still just saying, I don't know, it's whatever. Like I get anxious around people who are clearly not taking this seriously.
I know it pisses me off, and my wife is like Mama Bear. Like she'll give someone a dirty look, and she's not confrontational at all. Me, I'm a little bit more. I'll maybe say something like, "Really, you can't wear a mask," or give them because I think it's just it's ignorance. And then I just was reading this morning about a high school football game out in Idaho. The kid's father, they tried to get in the game. It was mask mandated. They wouldn't let him in. He was in the parking lot. Wouldn't leave. They canceled the game at halftime. So I had a client that was flying cross country right before training camp, going to get a work in LA with his quarterback. And he said there was someone on the plane, like with the mask on, not on. And they said something to him. And then he goes, "It's my, I can decide if I want to wear a mask or not." And it's just like, but yeah, that the ignorance and just the selfishness of some people with regards to that, not looking out for your fellow, person. I think that's pretty weak. That's pretty selfish, especially this thing right now. It's not going away, as we could see. And I don't know about everybody else, but I want to get back to the new normal. Being high, incarcerated. That's why I'm in probably the best shape of my life right now from all these prison workouts. I'm ready to get out and about. But definitely it's, being extra careful is something that's going to be is how I prepare my day, whether it's a meeting outside or not even meeting with someone or doing a Zoom or FaceTime call instead of physically being in an area or an environment where, I could be in jeopardy. So that's something that I just can't stress enough. And just the fact that doesn't matter what you look like or the type of shape you are. Like Jonathan said, this does not discriminate.
Mm-hmm. Well, speaking of, yeah, go ahead, please, John.
I was going to say, in terms of people wearing a mask, that, you've got your two different, or maybe more viewpoints, but, if you're walking outside and you want to enjoy the weather and you're not around anybody and you want to take your mask off and, take a stroll or go for a hike, that's one thing. But as soon as you step inside of a building, right, or a store or a plane, you've given up that right to decide whether you can wear a mask or not. And if that place is saying you have to wear a mask, that's private property. You have to wear a mask there. You have no choice whether you wear a mask. And if you don't want to wear a mask, then you don't go in there. And, do I say stuff to people outside when they're not wearing one? No. Do I stay the fuck away from them? Yes.
I
do. And Miss Dominique, you are in New York City, which was basically an epicenter. So how do the people inside of New York treat other New Yorkers? Because New Yorkers are famously, uninhibited.
So it was a dead zone for quite a bit. I remember, I didn't go to not Central Park, Times Square, and seeing like images of Times Square in mid-April, just no one there. And I was like, I wish this was like not part of the pandemic, because that would have been really nice to just go on a stroll in a very empty Times Square. I would say for the most part, where I've been, people have been, been pretty weary about like wearing their, well, not weary about wearing their mask and not wearing it, but like weary, like in terms of like not being around people who aren't wearing their mask. And I don't see a lot of that, but there are some things that give me pause. Like I did once pass by a restaurant that opened up, which is fine. But people inside and dining, normally no mask, that gave me a lot of pause. So I see like trickles of irresponsibility there, because you're in a, like Jonathan said, you're in a room enclosed and this is like there's no circulation, whereas like I can understand, and I've even done it myself. I try to be more active since this has gone, and I used to work out pretty regularly, but trying to get myself into that, I like really take precaution and be in isolated places. And I don't wear my mask all the time because, you know, it's isolated. But like if I'm around people, I'll wear my mask. And seeing people kind of like pick up where they left off at the restaurant was a little jarring. But I don't anticipate that to be the majority here in New York.
Mm-hmm. Well, Sean, you mentioned a little bit about getting back to or finding out what the new normal is. As we begin to wrap up, I want to give each and every one of you guys an opportunity to tell the people who you are, where you are, what you're doing, and if they have any questions or even if they want to work with you in some capacity. I really want to give each and every one of you that opportunity. So, Jonathan Soto, I'm gonna start with you. Tell the people who you are, what you do, and how they can find you.
No, thanks, Eric. Well, I'm based in Boston. I'm a personal injury attorney. Specializing in trial work and litigation for people that have been, injured in car accidents, premise liability, wrongful deaths, truck accidents, things like that. So I help to get these people made whole as much as possible. I can be reached on my website, jansotolaw.com. I can be reached at my office. Eric had the website phone number on the ticker, or I believe it was, yep, 617-618-5560. I'm available all the time. So if anybody has been injured or has been in an accident or knows somebody that has, I'd be more than happy to speak with them about what their rights are and how to protect those rights and how to pursue the parties that have wronged them.
Excellent. Thank you so much.
Thank you.
And Dominique, you are doing so many great things, and I know that you are working on a lot of special projects, you are not. These aren't projects where you can just kind of say, "Oh yeah, I'm going to do it. I'm going to see what happens." You are fully immersed in these projects. So tell us a little bit about what you're doing right now.
Yeah. So right now, for a while, actually, I've been working on a documentary about maternal mortality and morbidity in communities of color. And it's one of the things that my father, surprisingly, was a huge cheerleader for. So even though we took a pause and I was debating on whether to continue this, I remember how happy and excited he was to see this thing through. So we are continuing with our fundraising efforts because this will be a feature-length documentary. But in the interim, I'm also working on an audio docu-series, which will be released in podcast form about something similar to what Eric is doing, but pertaining to maternal mortality and COVID-19, there's been 3 pretty high-profile deaths of Black and Indigenous women dying from complications of COVID-19, and they were also soon to be mothers.
Okay, that's incredible. And Sean, I know that you always have so many irons in the fire. I couldn't possibly attempt to show or tell all of them, but I know for a fact that you are a player agent, you're an author, you're a podcaster, you're a dad, you're so much more. But I know that you are great at telling people about all that you're involved in.
I appreciate that, Eric. Obviously my full-time job as a full-time sports agent, and I take great pride in representing some of the guys that have taken the road less traveled, and having a fiduciary responsibility not only to get them the most money on the field, but also to pave the way for the next generation and make sure that we're continue to do charitable work that aligns with their brands and that these young men are passionate about. As a kid, I had learning disabilities, and you know, it was always a challenge to find books that I could relate to and I wanted to read and I could understand. So passionate about the writing component of No Backing Down, which is gonna, you know, someday is gonna be a feature film. You know, Angelo, hopefully, like as I mentioned, is getting close to finishing the movie script. And the kids book, I have kids. Proudest, you know, my biggest accomplishment is being a dad of four. So putting out, you know, and being able to do it with my daughter who is battling juvenile arthritis and lupus. You know, we're on a mission to plant seeds and to educate people on autoimmune diseases in children, which, you know, obviously taken very seriously, but I feel are a little underexposed. So we're really passionate about that. And working with younger athletes or younger student athletes in terms of, you know, when we're in regular times, going into schools, doing some motivational speaking with my client. That's always very fun and unique. The podcast I started, launched, you know, back in July, and you know, I love how it's going on iHeartRadio and Spotify and Anchor, and you know, people from all walks of life. You know, we're very passionate about getting out a clean narrative on the road less traveled, perseverance, adversity. People that are making a difference in their field. You know, trying to recognize that and bring that to light. So yeah, that's what kind of doing right now. If you can follow me on Instagram at Sean Stellato SES, or on Twitter, Facebook me, or you can drop me an email at Sean SEAN at Sean SEAN Stellato STELLATO.com. And would love to find, you know, I'm all about collaborating with good people, and hopefully we get back to the new normal for all you golfers and people that love football. The 2021 draft party will be epic at the Ferncroft Country Club in April, and hopefully, and we do that for the Junior Golf Fund for inner city kids that can't afford to golf, provide them with scholarships. So I've got a lot going on, but I appreciate it, and you know, great meeting you, Jonathan and Dominique, and hearing your stories. And Eric, thank you for thinking of me to have me on.
Yeah, I want to thank all of you guys. It's been incredible. You guys, you guys are just inspirational to me, because I mean, this is something that we all kind of know about. We hear a lot about it, but because I now have had this conversation with each of you individually and having this collective conversation, I feel like I know a lot more. I feel like I have experienced a little bit of COVID fatigue, right? It's been 8 months. You kind of want to do some things, but I think that this is a perfect opportunity for myself and for anyone who's listening to rededicate themselves to wearing masks, washing their hands and sanitizing, and trying to basically stay away from people. Keep your ass home if you can.
Stay home.
And but I want to just one last time before we begin to wind down here, I want to make sure that everybody knows about Sean and all of his great work. I want them to know about Jonathan and all the things that he's been doing and all the things that he's been through. Also, Dominique, I'm going to give you some extra special love. I want people, if they are so inclined, to check her GoFundMe. She's doing some great things in the world of maternal health for people, for black and brown, and all people, really.
Yes.
And so it's really something that I know that she is living along with recovering from COVID and dealing with the after effects as it went through her home. So for everyone here, thank you so much. For everybody watching, I want to thank you. This has been Wednesdays. It's been the Wednesdays at One show on Facebook Live. Thank you, everyone, and we'll see you next Wednesday.
Thank you so much.
Thank you.
Bye.
Bye, guys.
Thank you. Thank you, Eric. Bye, guys.
Thanks, Eric.